Hello and welcome to the first episode of the Friendly Fire Debate Podcast. In this debate podcast series, we'll be delving into controversial topics and policy areas and detailing our opinions and ways we can tackle them. I'm your host, Oliver Cookson.
And I'm your co-host, Al.
And in this episode, we'll be discussing whether the NHS in England should be privatised. And first of all, we're going to be discussing the framing and core areas of discussion within this very controversial topic of discussion. And later on, of course, we'll be debating in a lively, vigorous manner to try and come to a great conclusion and an ideal policy scenario for the UK. So first of all, to really be able to answer this question, the core component and area of discussion is, of course, the definition of privatisation, and this will shape exactly what area, where the debate will end up going. Certainly, with debates I've had in the past, this is surely a bastion of conflict. Now, of course, one of the most simple and often convenient definitions of privatisation is private ownership, opposed to nationalisation, of course, which we have currently in the NHS, being public ownership. Of course, this allows for flexibility in regard to things like state subsidies, which of course can be given to private companies to incentivise certain financial decisions.
So, as a proposition, you would like ideally to define privatization as the limited transfer of the ownership to the private entities. This way you can introduce some of the regulations and other things that will allow you to have benefits of the both worlds. As the opposition, you would like to challenge this definition and say that privatization is the complete transfer of the ownership. Of course, it depends what debate are you participating in. If you're doing competitive debating like I do, the judge would prefer for you to take as much burden as possible and go for the complete transfer of ownership if you are on both sides. If you are doing political debates like our co-host Oliver does, really you just need to choose the best side that you think that your country should take. The second thing that needs to be discussed during the framing is the characterization of the NHS. You don't really need to define NHS. I think it's pretty obvious, the publicly funded healthcare system in the UK. What you need to do at both sides is try to give the context to the NHS and describe it in the way that benefits your side. So if you are the proposition, you would like to describe NHS as bureaucratic, as inefficient, which could be solved by the competition and subsequently by the improved quality of care and reduced costs that private sector can bring on. If you are the opposition, you would like to describe the NHS as the system at the heart of which is the equality of access to everyone, which brings us the points of social justice, patients' rights, and minimizing the profit-driven motives. So this is the second thing that you would like to discuss for the framing. And the last thing that you would like to mention are the impact metrics based on which you will compare different arguments. So what you can use for this debate specifically, the metrics are the accessibility of the healthcare, the cost effectiveness, the quality of care, and patient satisfaction. On different sides, you will argue differently which impact metric is the most important, and you will use those impacts later when you will introduce your own arguments and try to weigh in the arguments of your opponents.
Yeah, and later on in this debate, I will be, as the proposition for privatisation, mentioning a distinction between health insurance and health delivery, which is very prominent in other countries. Of course, in the UK, within the NHS, we have these two components as one. We have both nationalised insurance as well as nationalised delivery, which means that this distinction often isn't mentioned in UK debate on healthcare systems. Of course, in France, for example, they have nationalised insurance, whilst they have private ownership of the delivery of healthcare. For example, hospitals and certain GPs, of course there are exceptions, are under private ownership, which allow for a best of both worlds, which is definitely going to be the ideal policy situation that I'll be advocating within this debate. So now we'll be diving into the body of the debate, and first of all we need to characterise where the NHS is failing, if it is failing. Now my co-host just mentioned in the characterisation of the NHS there are many different factors that we can look at, much like accessibility of healthcare, quality of healthcare, and also much more. So a great source of getting an overall feel of where the NHS is at regarding competition in other countries is the healthcare index. One of the most extensive sources that I found was available through Nambido. It was particularly good, and we're actually ranked 17th. Of course, this healthcare index takes in multiple factors that my co-host also mentioned, one of which is accessibility of care. Now, it is undeniable that the NHS exceeds in this regard. That's what any, if not all, nationalised insurance models provides. However, we do occur as almost equal to countries like Estonia, Qatar, Israel and Lithuania, with the majority of other European systems far above us, even those that are almost shocking. You have Luxembourg and Austria, Norway, Finland, Netherlands, France, Spain and Denmark performing far better than what we are. This, of course, is largely a result of the quality of care. But of course it's all well and good saying that without evidence. Who would I be if I didn't provide it? But we actually fall below average in regard to the survivability rates by a 5-year survival period in G12 countries, with us performing particularly bad in regards to survival from both lung cancer and colon cancer. As well as this, our 30-day survival rate in regards to heart attacks is the lowest almost of all the G12 nations. This shows that we are underperforming for our type of economic power and influence that we have. Not only that, our abnormal mortality rate is far above almost all other European countries. That's including Baltic and Balkan states, which would normally in other areas perform worse than us. This is a truly abysmal state of affairs in regard to our health service and our quality of care, and it is important that we reassess how our NHS is structured, how that may change and benefit the British populace. This argument on quality of care is something that even the opposition to this motion has to concede. Our waiting times are also some of the worst in Europe as well. But of course, we need to explain exactly how privatisation is the answer to these models, and this is where the opposition and proposition are going to have some true debate and discourse. When assessing possibilities to improve our healthcare system, it seems most rational to look outward to other countries and see exactly how they're developing. And within this debate, I will be advocating for a French type system. This is somewhat a unique opinion to take, as France isn't often viewed by other conservative figures, in my case, as a true private system. But by the very definition of private ownership of delivery of medicine, it very much is. Of course, much like the UK, it offers nationalised insurance, which means that healthcare is still free at the point of consumption. this means that it has the best of both worlds. It has that great accessibility to healthcare that we do have in the UK, which is the reason why we're not performing worse than we could be in the health index. But, of course, they still have that incentive and natural competition we see in private industries and areas of governance and delivery. Of course, just because an industry is privatised doesn't mean we can't protect the public through other means, which is something that I very much expect the opposition to discuss. Of course, regulation would be extenuous with a private healthcare system, much like the FDA within America is extremely thorough in regards to its medical advice and regulation. Of course, there are still mechanisms in which we can rein in our companies and ensure that we protect our populace through subsidies. For example, the government may offer subsidies that offer a larger profit margin for independent companies in regards to extra cancer screenings. That would hopefully allow for incentive to be precautious and ensure that cancer is detected early on, battling them very high cancer mortality rates discussed earlier.
As the opposition, the first thing you can do is try to rebut this definition of the privatization. What Oliver described to you right now is that you have the benefits of the both world. Through the national taxation that is purely for the NHS, you will keep the NHS accessible to everyone, while we subcontract the healthcare services to the private sector and allow the competition in there and thus the benefits from it, such as cost effectiveness, innovation, etc. So what you can do as the opposition, firstly, is to say, well, if the government regulates the prices for the health services, if the government regulates the quality of care, and if the government regulates the how this NHS is being paid via the taxation, well, truly, is it really a privatization? If the definition is the ownership and control of the public services that are transferred to the private sector. But okay, for the purpose of this side of the debate, let's agree with the definition that the proposition gives us. The second thing that you can do is try to rebuttal some of the benefits and arguments that are made for the proposition. What we heard right now is the France's healthcare system and its benefits. So first of all, you can try to rebut, is the success of the European countries that privatize the healthcare really come from the privatization or other factors that might have contributed to that? So first thing that you can say is that other European countries have way higher spending in proportion to the GDP in comparison to the UK. So of course, if the government is spending more on the NHS, there will be more fair wages for the healthcare workers. There can be high utilization of the services. There can be more equipment, etc., etc. And that can be one of the factors that contributed actually to the success. The second thing that you can say is that other European countries that are higher on the lists for the healthcare have a better preventive care. What this means is that there are more manual checkups on the patients, there are more proactive visits that help to prevent some of the illnesses before they reach the hospital and A&E. So mentioning the factors like this, what you can do with them is to say, well, if there are factors like this that have not been implemented in the UK fully or to the extent as the European countries, what we should do is actually implement those things such as preventive care and higher spending, and then we will achieve same or even higher quality of care and in other criteria as those countries like France. Because if we look at the statistics, the UK falls just a bit shorter than the France in the ranking, and we can see that the UK, despite the described horrors of the NHS, are still ranking